I'm Dr. Jim Wells-Smith, president of Vetel Diagnostics, and this afternoon I'm going to take a few minutes and talk a little bit about artificial intelligence and neural networks and how we utilize them in veterinary medicine. So the talk today is going to be in 4 different parts. The first thing is we'll talk a little bit about artificial intelligence. After that, we'll go into a segment of artificial intelligence referred to as deep learning. Then we'll look at how we utilize those tools in our imaging systems. And then finally, we'll wrap up looking at some of the new projects that we're working on and ways we plan to implement our neural network technology. So as you probably all know, artificial intelligence is a booming area in the economy and a big source of lots of development, especially over the last 5 or 6 years ago. And almost no matter where you are, something in your day is being helped, made more efficient or more accurate by some type of artificial technology, or artificial intelligence rather. And it's even been referred to as the 4th industrial revolution because of the impact that it will have on the world. And just looking at healthcare alone, in 2019, there were actually 106 startups just in human medicine alone utilizing artificial intelligence. So it's here to stay and it will be a big part of our future. There is encouraging information out regarding artificial intelligence in medicine, and in a recent article in the MIT Technology Review, the results are actually quite encouraging. Of the medical facilities that they interviewed, 7 out of 10 were either utilizing some artificial intelligence platform or plan to use it. But the better news was of the medical professionals that were using it, the majority felt that it saved them time by doing some of the mundane tasks for them. And many of them also felt that it was giving them more time to spend hands-on with their patients, which is certainly a good thing. So let's start with talking about deep learning and what it is relative to artificial intelligence. So deep learning is a segment of machine learning, which is a segment of this overarching umbrella of all things that involve artificial intelligence. And deep learning is unique in that you have a software platform that is constantly learning and getting better at what it does. It does this because you have a great deal of data that you're constantly giving it, and because computers are so much faster than we are, it can assimilate that data usefully. I like to think about these neural networks or deep learning neural networks, at least when it comes to being a veterinarian, as the veterinarian's apprentice. It's there to help you, it's there to learn from you, but it happens to be very, very fast. And because it's very fast, it can do things that for humans would take a long time, kind of like finding a needle in a haystack. And the reason that computers are so fast, or part of it, is how they learn or how software learns compared to humans. Humans think in 3 or 4 dimensions and look at things that way, whereas a computer sees an object in 16,000 dimensions. And so it's just able to see things that a human can't, and in so doing, it actually can help tell us what we don't know about something. So kind of said another way, I like this saying, you can't understand how birds fly by only studying feathers, but a human would see a feather as a single object, whereas a computer would be looking at that feather from 16,000 points of view and understanding every aspect of a feather and how it relates to each other. Recently in Europe, a group created a neural network in which they took the retinal images of several patients and combined that with all of the medical data for those patients. So their gender, their age, whether they had heart disease or high blood pressure, a variety of diseases. Then, once they'd perfected that neural network and ran a separate group of retinal images through it, they found that their neural network could identify many, many things just by looking at the patient's retina. For example, it could separate gender, men from women, over 97% of the time, as well as identify things like high blood pressure and diabetes. We had a similar experience when we were training our neural network to look at navicular skyline radiographs. And we found that our system was actually able to tell the right front from the left front, again, more than 97% of the time correctly. We still aren't really certain how it does it, but it does it every time, as opposed to a human, which is going to be about 50-50. So it just gives us a whole new perspective on information. So one other thing I thought I would throw in was just, why is it so fast? And these are just some properties that compare computers to humans. And we have pluses and minuses and differences in every way. But the big portion of it is a computer can process 10 billion bits of data in a second, and a human's brain can only do about 1,000. So that kind of explains why the neural network is going to find the needle in the haystack so fast, is it can look so much faster. So the beginning of any process of a neural network is called image classification, and you're just breaking up images into groups so that you want it to be able to recognize and separate. And this really began back in 2012, and there's a lot of competitions of different neural networks being able to do this, and it's been quite successful. But to really be successful, not only do you have to be able to identify what something is, but you have to be able to associate that with other data that's relative to the object that you want to talk about. So what does the process look like? At the beginning, you have to go through, because you're teaching a neural network something, you have to separate all of your images into different classes or categories that you want it to be able to distinguish. And then one at a time, you enter that particular image into your neural network, and you have to tell it what it is, so it can memorize an image with another piece of information. And this is the process that's known as curating a database. So generally that takes thousands to tens of thousands of images to just understand one particular classification. In this example, cats versus dogs. And when we were training our neural network to learn the 96 anatomies of the horse radiographically, we actually used over 1.2 million images for the training. So it requires a tremendous amount of data up front if you want it to work well and work accurately. Now, if you're feeling worried and you think that computers are going to take over the world, don't worry. Because computers don't have the ability to reason or contextual thinking, what we call common sense. And computers will never have imagination and be able to future think about things. And finally, a big advantage of humans is we learn from very small databases. For example, you only had to look at 2 or 3 cats before you knew what a cat was and that the cat was different than a dog. A computer would take tens of thousands of images to make that distinction. So when we look at image classification in medicine, here are just some early examples of how neural networks were used. So a group at MIT taught a neural network to recognize cells undergoing mitosis, which you see here on a photomicrograph. And then they used it in detecting cancer in lymph nodes. And when they ran their data set past the pathologist, they found that there was a 3.5% error rate compared to their neural network, which had a 2.9% error rate. But the good news is when you do both, when you have the algorithm run through the data sets and then have a pathologist review it on top, the error rate drops down to 0.5%, which is a very significant step forward in efficiency and accuracy of the diagnosis. So it's not to think that an AI platform will ever replace a doctor. It's just its intelligent assistant. Like I said, uh, the apprentice. And doctors aren't going to be replaced, but rather displaced. And that's a good thing. They're being moved from doing mundane things like report generation and actually spending more time with their patients. So a little bit about our history. As you may know, back in 2017, we were the first and actually currently only ones to bring a neural network and artificial intelligence into the veterinary community. And currently we have neural network algorithms that we are utilizing on radiographs for both dogs and horses. So for the rest of this talk, I'm going to show you how our systems work, first in classification of images, then in aiding the operator in the acquisition of radiographs, how we can detect mirrors or mirrored images, and then finally how we do geographic measurements and report generation. So let's just take a few minutes and look at those different things individually. So first off, we'll start with image classification, and I'll show you how we utilize it both in real time during image acquisition and also to analyze a variety of images in a database. So here, this is a video I'm going to play, and you should be able to hear in the background some of the voice annotation that's going on as well. So here we are. The system is actually, you're just taking the radiographs. No one has pre-programmed anything in. It's automatically doing the entire process itself. Then when you see the next radiograph being taken, it's going to recognize it, apply the appropriate image processing, announce what it is. And this is a real-time display. This is just how fast it will go. And gone are the days of having to pre-set up hanging protocols. They see it announce that. You're not having to use hanging protocols anymore. Go back to the computer. It does it all automatically. It does it faster than a person can. And if you make a mistake, you just repeat the radiograph and it will identify it and label it as well. So that's an example of image classification during image acquisition. Now next, imagine someone sends you an email with 50 radiographs attached and they want your review, and you've got to download them and go through and organize all the images, label them, and figure out what you have before you can bid. Something that takes a long, long time. And I'm sure people, especially those doing lots of pre-purchase exams, this is a part of every day sometimes. So what you see here is, and I'm repeating the tape while I'm talking, but you just import those 50 radiographs that you got attached to your email into our software. And then at about a half a second per image, it's going to recognize the image, properly orient it, label it, and organize it for you. And then if you like, you can even have the all the images sorted into a certain hanging protocol if you want them displayed a certain way every time. So that's another example of image classification. Our system is also very good at identifying differences between very similar images. So here, as we look at these two radiographs, which I have labeled for you, but if I hadn't labeled them, could you tell me which one was the right front foot and which one was the left front? Depending on your experience and skill, you might be right half the time, maybe more, but we will be correct 95% of the time of separating those two. So let's talk a little bit about how we do that. So the hock is a good example to look at. So typically of the equine hock, you're going to take 4 different radiographic projections, and I've shown them here where we've got the radiograph, and here's the radiographic projection. So this is the x-ray machine, this is the digital detector panel, or it could be a film. but this is just to show you the positioning of the beam. But for the oblique view, we find that some veterinarians take the medial to lateral oblique this way across the horse, and some do a plantar to dorsal projection to get the same view. And you can see it looks very much the same, if not identical. But our system can actually tell the difference of which one is which with respect to how the X-ray beam was applied to the image. So first of all, if you're doing the typical medial to lateral view, you can just see here, here's your X-ray beam, and here's the relationship of the detector panel. And you'll notice that relative to the calcaneus, the detector panel is very close. If you do the plantar to dorsal projection, which is indicated here, you can see that there's a difference. An object film difference is much greater here than it is here. And actually, when we started studying these images and realized that our system could discriminate or separate each of the two views based on how the radiograph had been taken, we realized that it was a geometrical measurement. And what that means is, if you look at the difference between, or the distance between the calcaneus and the detector panel here, it's actually quite a distance. And so this is going to cause magnification of this part of the anatomy in the radiograph in the entire image. And if you look carefully, we think, we actually don't know for certain, but we think the reason our software and our neural network can tell the difference is because based on the object distance, this area of the calcaneus is magnified. So the calcaneus looks bigger if the radiographic projection was in this plantar to dorsal, as opposed to this medial to lateral approach that you see right here. Other difficult shots to separate. Can you tell if this radiograph is the right or the left? Now we can do that pretty easily. Can you tell if it's the front or the back leg? And maybe you can tell, or maybe you can't. But we will get this right again more than 95% of the time. And again, we would wonder, how did our neural network figure this out? But because we know it can see the difference in our curated database, and we know what these images are, then it gives us a new perspective to go and look. And so one of the things we realize is, well, the lateral aspect of P1 always has more of a curve in it. So that can give you a hint of separating left and right. And then we also notice, well, there's kind of a difference in the way that the sesamoid bones are shaped on the front leg compared to looking at the way the sesamoid bones are shaped on the back leg. And so, again, no one really knows exactly how these neural networks figure out what they do, but because our neural network has the capacity to do it, and it gives us a fresh perspective of looking at the radiographs, we're now beginning to see what it is teaching us about how to separate different radiographic views. Next, we're going to look at how we use our neural network to act as an aid in positioning the radiographs. So part of making this successful is having a neural network that's very, very efficient, does not take up a lot of space, and can be used on your local computer in your digital radiography system. So by placing this in the computer real time, we're able to give immediate feedback to the operator in terms of how they're taking their radiographs. And it should just be remembered that a lot of the artificial intelligence, especially that's being used in human medicine, is actually being run in the cloud on supercomputers inside server farms. And we are able to do what we do just based on having our software running on the computer that runs the digital radiography system. So here's an example of a properly taken lateral foot radiograph. But if you have our our utility turned on for positioning guide. If you take this radiograph, then you get this message.
Poor alignment.
Because it's detected that the condyles are not properly aligned here in the coffin joint. And just here's some further examples of what it will do. Not only will it tell you if you've got improper alignment, for example, but also help you in selecting what you need to do next with your x-ray machine. So here we have a properly positioned DP radiograph where we've got P1 is essentially perpendicular to the ground and to the axis, the horizontal axis in the coffin joint. But here it's not, and you would get this message.
Generator more medial.
Here's one that's even got worse alignment, and you would get, in addition to poor alignment, you get this message of what to do with the x-ray machine.
Generator more lateral.
So here it's telling you by moving your generator medially, the alignment will improve. So again, it helps you very quickly take a better radiograph. Next, we're going to talk about a project we're working on. This is relatively new to what we've been doing, and that's identifying images that have been mirrored. So what we found is that sometimes veterinarians will take their radiographs, and typically they'll take all the lateral rights and mirror them so they face to the left to comply with preference to have the anatomy always be pointing with the head to the left of the image. And this was creating some difficulties for us when we were trying to sort images and classify them, as I showed you in my example where I said someone had sent you 50 radiographs attached to an email and you had to figure out which ones they were. But when we realized that, we then took our database and we went through it again, and we took all of our images and we mirrored them, and we told the neural network, this is a right front, but we've mirrored it, and then fed that through and trained it again. And now at this stage, and we'll continue to improve, but at this stage, if the image has been mirrored 84% of the time, we'll be able to tell you that it's a right front foot lateral projection that's been mirrored as opposed to a left front foot. And the way it does it, we believe, is kind of based on what I showed you when I showed you the way to separate the radiographic projections of the oblique views of the hawk. Anatomy will always be magnified in some way or another based on the radiographic projection and where the detector panel is placed, and that will be unique. And so if you orient an image, that will, if you mirror an image rather, that will show up different than the true image itself, and the neural network will be able to identify that very quickly. Finally, we'll talk about probably the most important aspect of what we do, and that's making physical measurements and report generation. So for years, our Metron software has been very well known for having the ability to automate the process of making measurements and categorizing the data associated with individual images. But now we have that process automated. So what you'll see here is the neural networks recognizing the hoof block and making a calibration. So all the images are magnification corrected. And then it's going through this 26-point markup here on the lateral foot. And it takes it between 10 and 12 seconds. And it's going to have all those measurements made. We're just showing palmar angle here. But it does 10 different measurements on the lateral and 6 on the DP view. And again, this process is all automated. It's more precise than a person can do it. And it's much, much faster. So that's the beginning of this measurement process to help you identify normal from not normal. Next, we will take it one level further and do the markup. Now this time the markup's being done in the background, and you just see our intellect module running. That's what the little neural network icon is in the corner. And in about 10 or 12 seconds, it's done that whole process that I just showed you in the previous slide. But then it takes that information, compares it to a database of normal, and generates a report for you. And you'll see that the report also shows the entire database and which quadrile the particular radiograph fits into relative to normal. We also give you the ability to go back to the image and update the report and add additional information, or in this example, I'm going to show you where it just automatically generates an e-signature for you. And then right from the DR system, you could send this report to an owner, for example. Now I just want to take a few more minutes, we're almost done, to show you some of the things we're working on and now and plans for future projects. So there's a lot we can do. We have a very robust neural network with very broad shoulders, and it can do much more than just look at radiographs. It can really look at anything that we teach it, as long as we have a properly curated database. So with images, in addition to radiography, we'll be looking at classifying and making measurements on ultrasound, histology, cytology samples, etc. But also our system is so fast that we can now take video clips and break them up into single images and then analyze each frame in a video real time as well, which can be very useful for ultrasonography, endoscopy, or some gait analysis that I'll show you in a minute. And then finally, it doesn't have to be an image. It could be an ECG or EKG tracing. It could be an audio file of a digital stethoscope. And we're looking at ways where we would take these two separate data points and merge them together. And we believe with the 16,000 dimensional approach to this data, we may find out new things about the heart, for example. So here is an example of analyzing video, and this is a couple of neural networks. So one is just recognizing each frame and knowing that that's a horse and a rider in the frame. And then once it recognizes that, it's taking the points that it wants to make measurements from and putting them on the horse, as you see them here on the tail head and on the foot and on the pastern. And this project is in its early days, but eventually you'll then be able to have software that will analyze the relationship between all these anatomical points that we've identified with the colored dots on the horse, and how they relate to each other, and help identify gait asymmetries and soundness issues. Here's another example that's very interesting, where we're looking at a cine clip of a echocardiogram, and the system is able to frame by frame measure the ventricular, or recognize the ventricle, measure its side, and then in a real-time way, I'll just repeat this video, calculate the ejection fractions. And we envision that one day this will be implanted directly into your ultrasound machine. So real time, it will be giving you the ejection fraction as you're acquiring the images. So that's a quick look at artificial intelligence and neural networks in veterinary medicine. And I thank you for your attention. And if anyone has any questions, I'd be happy to take them now. Okay, I guess it was a perfectly delivered presentation, and no one has any questions. So with that, I would like to thank you for your time, and if I can be of any assistance or help to you, please feel free to reach out to me at Vetel Diagnostics. Thank you very much, and have a nice day.